Okay, so we're going to talk today about Sean's first book, written pre-AI, Stop Aging in Its Tracks, the 11 winning secrets, proven methods, and practical solutions. So this title here, can you actually stop aging in its tracks without injectables? Seriously though, like we are living in this world where there's so much wellness and thought around Botox and different testosterone treatment. What was your vision for this book? Because I know you didn't write about that in here. So talk to us a little bit why there's another side to aging.
So the reason that I wrote the book is because, I was seeing a lot of common trends in really the 50, 60, 70-year-old patients that were coming in the door. And they were all, to me, many of these chronic ailments, low back pain, knee pain, shoulder pain, neck pain, and headaches, plantar fasciitis, these sort of things, these sort of common orthopedic ailments had one thing in common, really, one foundation of those 11 sort of secrets, right, that I talk about in the book. Or really, I think I call them winning strategies to really fight the battle against aging. And the commonality is that exercise is the most potent variable that we can truly change and invest in early on in order to live longer, healthier lives. Yeah. That is the crux of the Stop Aging in Its Tracks book. So you talk about biologics and hacks, and there are so many, and I'm wearing an activity tracker right now too. And, there's this big movement toward really objective wellness now. We've got Pronovo doing these total body MRI preventative scans. We've got, really functional medicine, which is an emerging field. That's really kind of almost, this book is 5 years old. Functional medicine has been around for a long time, but it's really just starting to gain steam in the past decade or so. And I think of, Peter Attia, I believe the name of the book is Outlive. But really, the premise of the book is not to give you these hacks or these, really sort of like, and I say like, it's going to tell you what supplements to take or really what, there's no trick to stopping aging, right? But you can either age well or you can age not well and get many of the common ailments that affect a lot of the patients that we see on the treatment floor on a daily basis. So that's what I try to talk about and address in the book.
What I like about this book is that it talks about the musculoskeletal part of aging, which we've really, I don't even think this is a word, I'm making it up, but glamified, how we look at and treat aging, right? At least from like a female perspective. And, basically turning 40 in 2 weeks, you get pushed all these ideas of wrinkles and what your skin looks like and what you eat. And yes, digestion is health and nutrition are a giant part of aging well. But some of the other aspects of aging and the thought around aging has been glamified, if I can make up that word. So I like that this book talks about the physical part of aging and not just like go for a run, go to the gym, lift weights, but you talk about things like low back pain, like actual ailments that people typically face as they get older. So can you talk about that a little bit? What is the number one thing you would say from a musculoskeletal perspective that when you're aging, people face?
I talk a lot about habits in this book, and I feel as though you are truly a result of your habits. And often what I see, when people are unwell in their 50s, 60s, and 70s, or truly have like chronic low back pain or chronic pain, it's that it's associated with poor diet. It's associated with being a smoker, ETOH or alcohol intake. And a lot of it, those are all modifiable risk factors. I didn't mention genetics there, right? So genetics is obviously part of all of our aging process. This book is about function and about controlling the controllables, right? Sure. What can we control? We can control how much sleep we get. We can control what we ingest. We can control how much physical activity and sunlight that we get. And those are really the main, and we can control our minds, right? We can control our minds by investing time in mindfulness. And, you and I go to church with our family, but, we invest in our relationships with our community, and we invest in really trying to uh, reflect and think about our lives on a weekly basis for maybe 10 minutes a day, maybe 5 minutes a day, but at least we think, and we try to, that's what we do. We meditate for our mental health.
Yeah.
And these are all controllables, and that's what I speak to in the book. Again, we don't talk about taking what's the hot weight loss, the GLP-1.
Yeah.
We don't talk about any of that stuff in this book. I think maybe that's another book that I can co-write with either an MD or a nurse practitioner who's a weight loss specialist. But this is the foundation, I feel like, for our patients to really reference when it comes to living a healthy musculoskeletal life into older age.
Yeah. For those that don't know, or I'm sure everybody knows what this word means in the, foundation or the basics of the word, but talk to us about what musculoskeletal really means. Like, what does that translate to?
To me, when I think of musculoskeletal, I think of really your muscles and your bones, right? That's your musculoskeletal system to me, anyways. And when I think of health and what that looks like, and there have been studies that tie certain muscle groups and certain actions to longevity, right? So you and I both worked in a skilled nursing setting, okay?
Yep.
Many of those folks were there and they were confined there because they had a limited level of activity. They were either mod assist or max assist. They couldn't stand up or walk on their own. Thus, they were in this sort of, and I hate to call it a sort of a purgatory, but sort of where they are, a skilled nursing facility where Brooke and I both worked, Brooke as a speech path and myself as a physical therapist, was really like and what would you call it? Like a 3 to 4 day to a potentially 90 to 120 day stay. Would you say?
Yeah.
Maybe even longer?
Yeah.
So, and this is, typically older folks who are more medically compromised. And when I think of aging well, and the reason that I talk about our work in the skilled nursing facility, I think about not turning into that, doing everything you possibly can to make sure that your muscles and your brain stay healthy.
Yeah.
So you can stave off the wheelchair, you can stave off the walker, and you keep your quads, your glutes, and your grip strength, which are the three main muscle groups that are tied to longevity, strong. So those are three controllables. And I talk about that in the book in different exercises that you can do on a daily basis that take less than a minute to make sure that you're moving the needle in the right direction. So you don't end up in a nursing home, or you don't end up wheelchair bound, because folks that end up wheelchair bound end up with a much higher mortality rate, because when you get up and you move around, blood circulates, your respiratory system does much better. And your bones do much better, because bones need gravity to continue to grow and be healthy.
Yeah.
So does your spine.
So if there was one exercise that you would have everybody do, as a PT, like if there was one exercise you would have everybody do to kind of try to prevent this from happening, what would that one exercise be that they could do every day?
Yeah, I mean, my brain just goes to a sit to stand, like a simple sitting down and standing up 20 times a day.
Just once, 20 times, up, down, or does it have to be more?
I think I talk about it in the book. I think about, this is back when commercials there were commercials on TV. Now I feel like there's no commercials anymore. We're filming this in January, February now, right around the Super Bowl. So I'm sure there's going to be Super Bowl commercials.
Yeah.
What I said in the book was like, just do 10 at every commercial and at every commercial break, 10 sit to stands.
Sure.
I also talk about posture in the book a little bit as I straighten up and you straighten up.
Yeah.
And we talk about chin tucks.
I love that exercise.
The stoplight, right? So doing 10 chin tucks against the headrest.
Yeah.
Every time you come to a stoplight.
Great exercise.
Make it happen. One of my former mentors used to keep a grip, one of the grip things you can buy at CVS, like the grip trainer. They're actually they can be pretty tough. He used to keep it in his center console.
Who's this?
It was Dr. Duvall in Atlanta.
Yeah.
And he was one of my first mentors, and he'd say, Sean, he's like, you have to use your hands as a physical therapist. So he said, buy one of these gripper things, because your hands are going to hurt for the first six months to a year that you do the job. So buy one of these gripper things and do 10 of them at every stoplight. And so I did, but I ended up mostly doing my right side and not my, and it was like a weird, but grip strength is directly tied to mortality. And when you think about grip, right, it's getting up off the floor if you have a fall, right?
Sure.
It's grabbing something from the cabinet that might be, like a plate or a gallon of milk off a top shelf. These are things that are tied to longevity and tied to, living a healthy, long life.
Yep.
But sit to stands are definitely, they get your glutes, which is one of your largest muscle groups, if not the largest muscle group. And, your quads, your posterior chain, and it's just really good for you.
Mm-hmm. How about those like active adults, the adults that are in their 60s, 70s, and they're active, like they're still working. I think about my mom, they're still working. They're physically still pretty good. This may not be top of mind for them, right? Like they're going to the gym, they're doing their things, they're healthy. Is there something that they should be more aware of now that could potentially impact them later? Like, you're talking about the sit to stands. I can understand that for somebody who's retired and, sits at home a lot during the day and, has to be cognizant of that. But how about those folks that are like in their 60s, 70s, still working, going to the gym? Is there something else that they should be thinking about or be aware of that they should be doing?
Yeah. I think that, it's interesting. I think that you should invest in a personal trainer, at least once or twice a year just to refresh your routine. I think that's really important. Make sure that they've got proper certifications and they're not just like a high school kid off the street. Like make sure they know what they're doing to make sure your form is proper. I would advise against, and again, this is just my personal belief, but, think about what you're training for. Our first location was next to a CrossFit. Those CrossFit athletes were in incredible shape, and many times they would train for the CrossFit games.
Right.
So it wasn't just working out to work out, it was working out to train for the games. So I treated those athletes a little bit differently than folks who were just there to lose weight. So people who are there to lose weight at CrossFit, I don't want them doing the power lifts at the same level that somebody who's there to compete in the games is, right? So two different types of approaches to your health and wellness, right? So as I think about the 50 plus year old, 60 plus year old, the weekend warrior, often who we see downstairs in the clinic, I think of a couple common trends, right? Number one, it's just a lack of flexibility, right? So how often, like, that's why you see all these stretch companies popping up everywhere, right? And it's like, oh, I just need to be stretched. Well, no, you need a combination of things, right? So you need to stretch. And the research shows us that you need to stretch that muscle group for at least 60 seconds every single day for 90 straight days statically to see a change in that muscle tissue for
You
at
talk
least
about that in the book too.
You got to stretch every day. So if you don't stretch every day, you're not going to see the changes that you're hoping to see.
Can you expand a little bit more on why it's 60 seconds? I think that's a good point.
Yeah, it's just that's what what the research shows is a minimum of 60 seconds of that static hold. It can be boring, but that's just what the research returns as a good low load, long duration stretch. Mm-hmm. One thing that I talk about as a concept to our staff is trigger points, right? And I'm not sure if I address this in the book, but if you're listening, maybe you'll get a little gem out of this. I think it's important to stretch, but what happens as we age is our muscles become a little bit less, basically watery, right? And they're not as hydrated as they used to be, okay? The tissue and the cartilage, everything changes and it just becomes a little bit less hydrated over time. That puts strain at our teno-osseous or tendon bone junctions, which is kind of what gets you the tendonitis, the tendinopathies, or those really the painful joints, okay? So what happens, you see sort of like this shrinking of muscle, and also what happens if you're not working out on a regular basis is fat actually starts to infiltrate the muscle tissue. So what happens is, when you work out and your muscles build and your muscles break down and they build and they break down, like that happens every day when you work out. If you work out, and even if you don't work out, anytime your muscle is challenged, it's going to break down and build back up. Trigger points happen along the length of a muscle. Okay. So a trigger point is like a knot. Everybody's had the feeling of a knot in their neck and it feels like a bump. And if you've ever gone to a massage therapist, what do? They put their finger on the bump and they try to hold it until it hurts, it hurts, it hurts, and then they release it. And all they're really trying to do is give it a moment of anoxia, which is no oxygen, no blood flow. And then after that, the blood flow rushes in. Okay. And that's supposed to create some healing effect or some soothing effect. At the clinical level, we use Graston tools to break up these really what they look like under a microscope are like rubber band balls of just muscle tissue. So this is the way I explain it to patients without going off on a tangent. If your muscle is tight at the origin here, you're going to get pain. You're going to, anytime you bend it or stretch it, that tightness is going to pull and it's going to cause a breakaway of between the tendon and the bone or the muscle and the tendon. That's tendonitis, okay, or tendinopathy. When you have trigger points in here, when you're stretching for a low load, you're just stretching around those trigger points. So what needs to happen is you need to get in there with a Graston tool, a needle, shockwave, something to stretch out that tissue because it's not going to change otherwise. You need to get in there with your hands. That's why we're such firm believers here of manual therapy, because in order to get this to have less strain at the origin and the insertion of the muscles where the tendon hits the bone to create the action, you have to address the muscle. You have to get in there and loosen these trigger points up to then allow for length so that there's not all the tension, not all of the problem is coming here, or not all of the lift is coming from there. Mm-hmm. So when I think about it, I think that physical therapy is a normal part of life, and most people say like they can't afford massages and they can't invest in a massage because they can be expensive, But I would just challenge you to say, like, why not go see a physical therapist every year who can do a total body assessment, which your insurance should pay for, and have them assess you. Where are your strengths? We do manual muscle testing here. We look at range of motion. That's our jobs, right? So we're going to pick up if your Achilles are tight, your hips are tight. We're going to work on you. And that's literally would be a plan of care. We loosen up your muscles and make sure that we're preventing those injuries from happening. Because chances are when we find something, it's going to cause and elicit a little bit of pain too.
Sure.
That's the other thing that I'd love to touch on here too, is that a lot of folks will present to PT because of function, something functionally they can't do. They may not be in pain. Most people associate, I got to go to physical therapy because I have pain. Some people may not be able to pick up their kid off the couch or pick up their kid off the floor because they functionally can't do it or they're stiff. It's not always a pain diagnosis. And I think those diagnoses are the ones that would benefit the most from PT and from a proper, not only a stretching regimen, which you can do on your own, but coupled with some professional help, like hands-on therapy.
Sure. I feel like too, as a PT, you see it that way. And I think the general population are starting to understand physical therapy a little bit more. But as a non-PT, I actually feel like, and again, maybe this is making this shift, that people wait until they have an injury, and that's what they associate PT with. Like, I sprained my ankle. I had a knee replacement. I have, pain. Like, it's almost like injury equals physical therapy. But what I'm hearing you say is if there's something physically you cannot do that's meaningful to you and that you do in your day-to-day life, it doesn't need to be an injury. Physical therapy is your answer.
I think establishing a relationship with a physical therapist, a great primary care physician is number one, who can direct you to different specialties. I think that's really important, especially as you age and, as we know, the risk for cardiovascular disease, any sort of memory dysfunction, cancer, all these things increase with age, right? So that primary care relationship is super important. That's number one. Number two, musculoskeletal injuries are so prevalent, and they're not even like, you should not be going through your primary care for a sore back or a sore knee. You should be able to come directly to a physical therapist. That's why we're here. And I think that our field is doing a better job of marketing that and displaying that. And we really are here, at least in Central Mass, the number one stop for any sort of musculoskeletal care. Mm-hmm. People come to us directly, and what's great about the doctorate in physical therapy as the field has changed over the last, decade or 2 decades, is that we're able to refer red flags. If something comes in that just doesn't smell right, we often will send you out to urgent care or send you, send you back to your PCP or to the ER if need be. But I think a relationship with a physical therapist is one of the most powerful assets that you can create.
Absolutely. I want to go on the like other end of the spectrum. So we talked about like the active adult and we talked about, people coming into PT and building that relationship. What about, those individuals and maybe it's somebody's family member who's listening to this podcast episode that thinks like they're too late. They're too late to change anything physically, whether that's because of age or whether that's because of the severity of what they're feeling or their mindset. You know, what do you say to that, to those individuals that think it's just too late?
Yeah, just the research says otherwise. You can build muscle well into your 90s, and potentially even beyond. There's probably just not research about it. But at every level, you can build muscle. I mean, when you think about it, the foundation of building muscle is always there. It's growth hormone and testosterone. It may not be in the same levels as when you were younger and in your teenage years, 20s and 30s, but the foundation and the building blocks of building muscle never change. So, but I do think it's important to recognize one word and one thing that's kind of it's sort of it's something that you have to you need to acknowledge as you age. And that word is sarcopenia. So sarcopenia is just a fancy word for age-related muscle wasting.
Mhm.
Okay. So they say after the age of, and correct me if I'm wrong here, somebody I'm sure on this who's listening to this podcast, I might get this off by a year or two, but 35, 36, or 37, after one of those years, and let's just call it 37, every year after the year 37, you lose about 1% of your muscle mass
Wow.
as you age.
No matter what you do?
So this is the big if. And this is tried and tested. If you work out on a regular basis consistently, getting that zone 4, which is really like, I believe 70 to 80+% of your heart rate max. If you're working out on a regular basis 3 to 4 times a week, you're able to stave off that muscle wasting, right? If you choose not to work out and not to lift and challenge your muscles, you will experience that muscle wasting. And what happens and where we see it the most is specifically in the shoulders. We see fatty infiltrate of the rotator cuff muscle. And every decade after the age of 50, so 50-year-olds often have an insidiously torn, or just like I use the word insidious, it's a big word, but that just means there's a partial tear most likely in your rotator cuff from just living daily life. Mm-hmm. At 60, there's like a 50+% chance that you have potentially a full tear in your rotator cuff, but you're still functioning properly. At 70, most people have a partial tear in their rotator cuffs. And at 80, probably almost everybody has a partial tear, if not a full tear in their rotator cuffs. Now, does that mean that they can't do their activities of daily living or that they have, crazy pain? No, not at all. It just means that their muscles are partially torn and they're not as strong as they once were because they're infiltrated with fat and they're, that's just part of the process. But what we talk about in the book, or what I talk about in the book, is I give specific exercises, especially for low back, knee, and shoulders.
Yeah, I see that.
To stave off the common rotator cuff dysfunction, low back dysfunction. 8 out of 10 people will experience low back pain in their lives. Low back pain is one of the most difficult diagnoses to treat as a PT. I mean, there's a whole field of practitioners, chiropractors, that treat theoretically just low back pain. And I know many of them do much more than that nowadays, but it just shows you how prevalent it is in our society. So, to me, my personal opinion on low back pain, having read the APTA put out a modified, meta-analysis, which is an analysis of, 100+ randomized controlled studies, which is level 4 evidence. A meta-analysis is level 5, or our highest level of evidence as a field. And I believe there was a recent one in, gosh, I want to say it's in the 2020s plus. There was one in 2010, and they probably update it every 10 years, or they should update it every 10 years because it's 50% of what we see orthopedically.
Right.
But the premise is, and these are my takeaways, is that you need to stretch, right? You need to drink enough water. and you need to stay strong, right? You need to keep your core strong and you need to move. Bending and twisting under load is a recipe for disaster, right? And I think that proper body mechanics really matter when it comes to low back pain. I think that ergonomic training, so when you're at work, having somebody who can come in and honestly show your team how to properly sit, how to set up their station, how to get up and go for a walk at lunchtime or move, your body, your spinal discs crave movement. It's so difficult to treat low back pain because there is no panacea, one size fits all fix for low back pain.
Sure.
So,
Yeah.
yeah.
I think you brought up a good point too, because a lot of people I think are not afraid of movement, but they're, especially as we get older, afraid of going to the gym, doing a complicated exercise, right? Might be afraid of exercise. And I think you're talking about functional movement, right? Like getting up and going for a walk or, doing a stretch or whatever that may be, which is way more digestible for a lot of people and not intimidating. Can you talk a little bit about physical therapy because in terms of that, because I think there might be this thought process sometimes that it's intimidating, it's going to hurt, or the exercises are going to be too tough, or I'm too old to come to PT and everybody else that's here is a weekend warrior. Talk about that a little bit and how there's what we can do as a PT industry to really help those who feel that way.
Yeah, and I just think about it, what would you be willing to do, to be able to, and again, we were blessed with the reference of the nursing home when we were in our 20s, right? So we know what aging poorly, whether you had control or not, looks like in the end.
Right. Yes.
And I think that especially at 70, 80 years old, it is a gift to continue to be able to move around, and to be healthy in that manner.
Absolutely.
And the reference that I always use, and I tell this to our PTs, is, if you go to the gym once or twice a week, and because the typical PT plan of care is what, like 2 days a week or whatever.
Yeah.
And I don't know who came up with that number, but that just seems to be like the industry standard. I don't know. Maybe it's around insurance, ramifications and stuff too. I don't know. But it seems like 2 times a week is the typical frequency. Well, I would challenge that, right? So I would say, show me on your calendar. Again, it's like, show me on your calendar where this matters to you. Where does movement and living a healthy life and lifestyle matter to you? Because exercise is the most potent variable that you have major control over.
Mm-hmm.
So, when I think of a plan with like an elderly patient of mine, and it depends, like, how complicated they are, what's their past medical history, I always think about getting them first excited about, movement again. Because there are dopamine pathways and serotonin pathways. And, you get a rush when you work out, right? Even if it's a little workout, but your body needs to adapt to that exercise. And you generally feel better after you work out, having worked out, than you would have had you not worked out.
Sure.
So I think getting people into that habit, and if they don't have any barriers to getting to PT a few times a week for the first couple weeks, I always love to start them strong because it gets them excited about coming back, and then from there, you're just keeping a cadence of, and I hate to use the word maintenance because it's like overplayed in the PT world nowadays. We're not maintaining, we're continuously building muscle and building growth and building function. Those potentially with Parkinson's or other diseases that are, debilitating and can be debilitating and life-threatening, those might go to a maintenance type stage, but people can build, to your original point, people can build muscles into their 90s. So my challenge to anybody listening to this is, why wouldn't you take advantage of that major opportunity today, right? So you take advantage of that opportunity, you could change what your life looks like in a year, right? Imagine if you could walk a mile without having to huff and puff. Imagine if you could run a mile without having to huff and puff. Like, running isn't the enemy. I know many people who are able to run into their 50s and 60s without knee pain or foot pain, right? But they've had the proper guidance and coaching. Think about PT as sort of a coach, really. That's a lot of what we do at a doctorate level.
Yeah.
Yeah.
The other aspect in this book that we didn't talk about yet, but I love to talk about this, is you mentioned the brain and, how that's really important to continue to age well. And what I always like to say to everybody is your brain controls everything in your body. So your brain controls your muscles. If you don't have that healthy brain, it's not going to have your muscles be utilized in the way that they should be utilized, right? Those are the neurological changes that people experience, and all the exercises in the world may not necessarily have the impact. So when we think about the way the brain plays into how we build muscle as we age or maintain muscle and how we function physically, what would you say is the biggest like takeaway from that?
So two things. When I think about the brain and muscle, I think about neural adaptation to exercise, right? So some people want results and they want it right away, right? But if you've never done an exercise before or a specific exercise, like many of the ones that we do in PT, it takes 2 weeks just for your body to adapt to that new movement pattern before you're able to then build muscle
Mm-hmm.
and get stronger. So I always say if you've never worked out or done these specific PT exercises, it's going to take 20 to 25% longer, maybe even more than it would in a typical plan of care. Okay, so that's number one, neural adaptation to exercise. The second thing that I think of is immediately I think of this study where they put somebody on a recumbent bike for 10 minutes and compared a placebo. And they looked at the brains under functional MRI scanning. What do you think happened to the brain that was on the bike for 10 minutes?
Did it just light up in different areas?
Lit up everywhere.
Yeah.
Because think about what cardiovascular exercise is. It's a function of permeating microvasculature. You increase your blood pressure when you work out, right? Your
Mhm.
heart works harder, and it's pumping that blood into places that otherwise may not have been permeated, like those
Absolutely.
little microcapillaries in the brain.
Yep.
Okay. So I tell anybody who's like afraid of Alzheimer's disease or afraid of, dementia or age-related changes in the brain, 10 minutes of a day of aerobic activity
Mhm.
gets your brain going. And the other, and I learned this from Leslie Day, my anatomy teacher. It's a crazy fact, but every extra pound of fat that you have on your body is an extra mile of vasculature that your heart needs to innervate with blood. So just being aware of where you sit, I don't love the BMI scales. I think that there are better ways to do it. DEXA, obviously, being the number one scan for body fat, body composition. I believe they have one in Chestnut Hill. It's expensive. I'm not telling anybody to go get a DEXA scan. I have a scale, I think, at home that pairs with the Whoop that gives you like probably generally where you're at for visceral fat, which is the most important type of fat because that's the stuff that's sitting around your organs. You don't want much of that because that's what really causes disease, is what we're finding out. Be aware of that. The more weight that you're carrying and your diet, just be aware of what you're putting in your mouth, because every extra pound of fat, a mile of vasculature that your heart needs to innervate, I don't know. I think, it makes you think twice about eating that donut that I had on Sunday at church. So that's good.
Oh, yeah. That was good though.
Yeah, what's good?
Everything in
Jelly donut.
moderation, right?
Yeah.
Yeah. At the end of this book, which is so nice, and I think for anybody who, is going to purchase this or is thinking about it, you should stop aging in its tracks, is at the end here, you actually have a list of all the exercises. Like you spell it out. And it's not an overwhelming amount. Like we talked about, that a little bit. Like you shed light to that, where sometimes people can feel overwhelmed by going to the gym or exercise, especially as we age or you haven't done it in a while. I know I feel that way. It's intimidating. You have really basic, easy things you can do, exercises here at home with a band, pretty much, for all of these, or a towel. So that's golden right there. Like that's a gold mine. That's such great value in this book. Is there anything else that you want to mention that we didn't get to touch upon that you feel really valuable?
No, I think habit stacking is super powerful. So show me your schedule and I'll show you your outcome, right? So if you want to lose weight, show me what you're eating every day, right? And show me where you're planning your meal prep. If you want to if you want to live a healthy, strong life, show me every day where you're going to the gym or you're going for a walk with your dog, right? Where are you investing your time? And I'll show you what you're going to look like in 20, 30, 40 years.
Mm-hmm.
Those exercises are my personal recommendations. So that's not like from ChatGPT or any of that stuff. Like that is me. That is 15 to 20 years of being a PT and distilling as generalized as possible what's the best for people to stay strong and to live a healthy life.
Sure.
It's not going to, it's never a substitute for getting a personalized evaluation. But I've seen a lot of visits in my career, and those exercises are really the core of a foundation that you build on for each of those body parts.
Yeah, that's great. Super valuable. Book your PT eval, folks, and get the book.